The following video introduces the Hartmann Zetuvit Plus superabsorbent dressing and summarizes its features and benefits. This product easily and efficiently manages a variety of superficial, moderately to heavily exuding wounds. The dressing is indicated for acute wounds, such as traumatic wounds, postoperative wounds, lymphatic wounds, and arterial leg ulcers, as well as for chronic wounds such as pressure injuries, venous or mixed leg ulcers, and tumor wounds. Zetuvit Plus can also be used under compression bandages. The dressing should not be used on dry wounds or on exposed bones, muscles, or tendons. Do not use Zetuvit Plus in case of hypersensitivity to any of its components. This video demonstrates the product's ability to absorb liquids and compares it to a leading superabsorbent product as well as a popular silicone foam. For this demonstration, we will use 80 milliliters of saline solution with a little food coloring added for easier visibility. The silicone foam, the other brand of superabsorbent product, and Zetuvit Plus are all labeled as 4x4 dressings. We start with the silicone foam and the competitive product to give them a small head start. As you can see, Zetuvit Plus is much larger, even though all of the dressings are labeled the same. Superabsorbent dressings are designed to overlap the wound edge, so you can use the full capacity of the larger Zetuvit Plus. Once all three dressings are placed in the Petri dish, we start the timer. While we wait for the dressings to absorb, let's review the construction of Zetuvit Plus and what each layer is designed to do. The first layer is a soft hydrophilic wound contact layer. This ensures fast transfer of exudate into the dressing and prevents adherence to the wound. The fluid then moves into the diffusion layer, which offers quick and uniform distribution of the exudate into the superabsorbent core for optimized fluid handling. The unique superabsorbent core of Zetuvit Plus absorbs and traps fluid securely even under compression. This means it will trap the wound exudate and anything it contains, such as excess MMPs, bacteria, and odor-causing chemicals, to help reduce odor and effectively reduce the risk of maceration. The unique combination of loose cellulose and superabsorbent polymer, or SAP, also produces a padding effect for added patient comfort. Lastly, the green water-repellent outer layer has soft edges, which are comfortable for the patient, and the water-repellent nature protects clothing and bedding from exudate strike-through. It is also permeable to air, which prevents the dressing from being occlusive and allows for improved fluid handling. After 2 minutes, the silicone foam has expanded significantly and no longer fits into the 5x5 Petri dish. It has absorbed as much as it can, but the liquid quickly drips back out when holding up the dressing. The other superabsorbent dressing also loses some of the saline when held up. Only Zetuvit Plus has already absorbed all of the liquid and already retains it against gravity. While this demonstration with saline shows the absolute advantage that Zetuvit has over the other dressings, it can be argued that some of the advantage stems from its larger dimensions. When comparing two 4x4 products that are similarly priced, Zetuvit Plus likely will offer much more dressing surface. However, our lab data with blood substitute also shows the relative advantage per square centimeter. The amount and construction of superabsorber used in Zetuvit Plus gives it the advantage in absorption, retention, and absorption under compression. In an observational study published in the Journal of Wound Care, patients treated with Zetuvit Plus showed a reduction in wound size and a very encouraging 65% decrease in peri-wound maceration, which is shown here in the red columns. The number of patients with healthy peri-wound increased from 5% to over 25%. In the same observational study, approximately 95% of patients and clinicians rated Zetuvit Plus to be excellent or good regarding fluid management, patient comfort, ease of dressing application and removal, prevention of leakage, and other criteria. After 5 minutes, it's clear that the silicone foam cannot absorb or retain this amount of liquid. The other superabsorbent dressing has absorbed much of it, but its retention against gravity or pressure is poor in comparison to Zetuvit Plus. As this demonstration shows, Zetuvit Plus superabsorbent dressing is especially suitable for the treatment of moderately to heavily exuding wounds. The dressing promotes wound healing by allowing excessive exudate to pass quickly into a superabsorbent core, locking away excess MMPs and other wound inhibitors. Exudate forms a gel inside the dressing, resulting in odor control, a barrier to bacteria, and a significant reduced risk of maceration. The high absorption capacity of Zetuvit Plus helps reduce the frequency of dressing changes, saving clinicians time and expense. In addition to the absorbency, Zetuvit Plus also offers a padding effect. Zetuvit Plus is available in a variety of sizes, from a small 4" by 4" up to an 8" by 16" dressing. If you would like additional information on Zetuvit Plus or other Hartman USA products, please reach out to your Hartman account manager or call our customer service team at 1-800-243-2294.